Hi, I am Dr. Suchithra Reddy, IVF consultant at Motherhood Hospitals, Sajapur. Today I will be speaking about oocyte freezing. It can be also called as social egg freezing. So why are we talking about egg freezing? Many women nowadays come to us at a later stages of their life when they have finished their career and all those things. When they come, we are facing like reduced egg reserves. They are not able to conceive naturally, and even when we try for IVF, we are not able to get enough number of eggs. So in such cases, nowadays women are career oriented. It is not like you need to complete your family and then go for career. There we have an option of egg freezing, or called as oocyte freezing, wherein you can freeze your eggs at the age of 25 and above to 30 to 32 years, then complete your career, then go for the family later on whenever you are ready for your family. So how are these egg freezing done? So it is a form of IVF procedure only. So here when the woman comes to us for the first time, we explain them regarding what are the investigations they have to get it done, like thyroid levels, hormone called as prolactin, which comes from the brain. So these hormone, and an AMH blood test. So this is a blood test wherein we will be understanding their egg reserve. So once these investigations are done, then we do a scan called as antral follicular count on second or third day of your periods. So once everything is fine, so we will have to start their hormonal injections, which are FSH hormone and LH hormone. So these hormone injections will be given over a period of 9 to 10 days, because the number of follicles have to increase their size from 3 mm to 8 mm to reach to around 18 to 20 mm, which happens over a period of 9 to 10 days. So these days they have to take the injection. And why they have to take daily injection? Because the hormone injections which we give acts only for around 18 to 24 hours. So then they have to take it daily. So once they start the injections, we will be doing their scans frequently to monitor if their follicles are growing well. So once at least 2 to 3 follicles reaches around 18 to 20 mm, then we do the egg retrieval. So this procedure is done under anesthesia, wherein the patient is put under sedation and a transvaginal probe is introduced inside the vagina. Under transvaginal guidance, we take the eggs outside from each ovaries. So once we take the eggs outside, we see them under the microscope. We screen them for mature eggs and immature eggs, and whichever eggs are mature, those eggs will be frozen. So these eggs, once they are frozen, it can be utilized whenever you need. Is called as social egg freezing. And in certain cases, like the patient is very young and she is being diagnosed with certain cancers, or she has to undergo some chemotherapy or the certain other surgeries, but she wants to preserve her fertility. In such cases also similar methods are used and their eggs are preserved, so that they can finish their chemotherapy or radiotherapy and undergo surgeries, whatever is required. So there already their eggs are frozen, and they can utilize these kind of these eggs later in their life, because chemotherapy and radiotherapy will definitely reduce the egg number and reduce the egg quality. And when you are planning for egg freezing, definitely you have to know one thing is, like, instead of coming to us on a later age, like after 35-36 years, where the egg number is also reduced and egg quality is also reduced. Instead, if we are planning for egg freezing, better to approach us in your early 30s or late 20s. So wherein your egg reserve is also normal and your egg quality is also good. So chances of success rates in future when you go for the embryo transfer, it will be on the higher side. So I think people are thinking about egg freezing or IVF itself as a stigma. So people are coming forward, or they should remove the stigma from their minds, and they have to come forward and undergo this egg freezing to preserve their fertility and to reduce the chances of infertility in the future, or chances of going for a donor eggs and all those things in the future. Thank you for listening to this. If any other further doubts you have, you can always visit us at Sajapur branch Motherhood. Thank you.